we're going to talk about the 3 Ps of pregnancy. We're still on NCLEX and pregnancy. There are so many things we need to learn. And today we're going to get into a lot of them in detail. So you need to know these 3 Ps. Very, very important, very, very critical for you to know. We have what we call presumptive signs of pregnancy. We also have probable signs of pregnancy. And we have positive signs of pregnancy. Let me say it again. Presumptive signs of pregnancy, probable signs of pregnancy, and positive signs of pregnancy. Please, you need to know this and master it very well. Now, presumptive signs, these are signs, they are subjective signs, like it is the patient who is feeling them, okay? Signs and symptoms, and they are reported by the patient herself. These signs may or may not be related to pregnancy. And when I start giving you examples, you'll understand what I mean by that. And then we also have probable signs. These are objective signs and symptoms that are noted by you, the nurse, assessing the patient. They may or may not be associated with pregnancy. And then the positive signs, they are signs which can only be associated with pregnancy. So presumptive signs are signs or symptoms are things which are felt by the patient, right? These are things which are felt by the patient. Probable signs are signs which are noted by the examiner, but they may or may not be associated with pregnancy. And positive signs are signs which can only be associated with pregnancy. So let's go through it because I'm going to quiz you on it. So please make sure you are mastering this. Number 1, presumptive signs, amenorrhea, nausea and vomiting, increased size and increased feeling of the fullness of the breast, pronounced nipples, urine frequency, okay? Then quickening, which is the first perception of fetal movement by the mother that may occur between 16 to 20 weeks. And then fatigue and discoloration of the vaginal mucosa. We said that these are signs which are felt by the patient. For example, is it only pregnancy during which patient does not menstruate? No, there are so many causes of amenorrhea. So many of them. So many causes of amenorrhea. If the patient is using contraception, if the patient has had, even if the patient is a strong athlete, at times they may not even menstruate, right? Number 2, there are so many things which can cause nausea and vomiting, right? Number 3, there are so many conditions which can cause feeling of fullness in the breast. There are a lot of conditions which can cause pronounced nipples. So these are what we call the presumptive signs of pregnancy. Now, let's go to the probable signs of pregnancy. We've looked at presumptive. That is, it is subject to the patient. The patient feels, like that. What about probable signs of pregnancy? Uterine enlargement. And we learned that there are other things which can cause the uterus to be big. For example, even if the patient has uterine fibroids, the uterus can be big. Okay? Uterine fibroids. Number 2, Hager's sign, where there's compressibility and softening of the lower uterine segment. There are other things which can also lead to that. Then we also have the Goodell's sign, where there's softening of the cervix. Okay, and then we also have the Chadwick's sign, which is violet coloration of the mucous membranes of the cervix, the vagina, and the vulva. So note the difference between Goodell and Chadwick. Goodell is softening, Chadwick is color change. Then we have ballottement. It is spelled as ballotment, but ballottement is rebounding of the fetus against the examiner's fingers. So when you're examining a uterus with a baby in it, you know the way it feels like. And then we have the Braxton-Hicks contractions. Some people call it false labor because the patient may have, these irregular, painless contractions. Some people call it false labor, Braxton-Hicks contractions. And then you can also have even a positive pregnancy test. So you realize that these are probable signs of pregnancy, but that does not mean that the patient is pregnant. For example, you can have people who have positive pregnancy tests, but they are not pregnant. Even in males who have testicular cancer, you realize that beta HCG will be high. So not every positive pregnancy test means that the patient is pregnant. Not everyone who has, who says, I feel I'm pregnant and I'm having contractions means that the patient is actually pregnant and is contracting, right? So please learn the probable signs of pregnancy and learn the presumptive signs of pregnancy. And then let's go to the positive signs of pregnancy. Those ones, if it is there, it means the patient is actually pregnant. The first one is fetal heartbeat. If you feel or perceive fetal heartbeat on ultrasound or Doppler, it means the patient is pregnant. Number two, fetal movement, which is palpated by the examiner. It means the person is pregnant. And if you also do ultrasound and you see the fetus there, it means the patient is pregnant. So these are what we call the positive signs of pregnancy. And because we've done this now, let's try some questions on positive, presumptive, and probable signs of pregnancy. So let's go. Please, I need someone to read this question for us, please. I need someone to read this question for us.
Okay. Which of the following signs are categorized as presumptive signs of pregnancy? A. Uterine enlargement. B. Chadwick's sign. C. Fatigue. D. Ballotment. Presumptive signs of pregnancy.
Yeah, which of these symptoms or signs are presumptive signs of pregnancy? A. Uterine enlargement. B. Chadwick's sign. C. Fatigue. And D. Ballotment. Which of them? Okay, I'm seeing some answers. People are going for C, presumptive. Beautiful, presumptive. Because we said presumptive is presumptive, right? So C is the answer. Presumptive signs are those that suggest but do not confirm pregnancy. All right. Fatigue is one of those signs, along with other signs like nausea, vomiting, increased size and fullness in the breast, urinary frequency. So please, if you forget everything, this one, don't forget. I'm going to learn the presumptive, the probable, and the positive signs of pregnancy. I have another question. Let's try another one. I need someone to read this for us, please.
Which of the following signs are considered probable signs of pregnancy? A. Amenorrhea. B. Goodell's sign. C. Positive pregnancy test. D. Fetal hair rate detected by electronic device.
So class, everyone type your answers. Is it A? Is it B? Is it C? Is it A? Is it B? Is it C? We are looking at probable signs of pregnancy. Probable. And the answer is B, Goodell's sign. Goodell's sign. B, Goodell's sign. Goodell's sign. Goodell's sign. So Goodell's sign, probable signs are those that suggest probability but still do not confirm pregnancy. Goodell's sign, and so it should even be B and C, sorry. So Goodell's sign, probable signs are those that suggest the probability but still do not confirm pregnancy. Goodell's sign, along with Hager's sign, Chadwick's sign, positive pregnancy, all fall under that category. Okay? Hager. Another one, please. I need help. Someone to read this case for us.
Okay, so a colleague nurse is assessing a lady who states she's sure she's pregnant in the outpatient clinic. Which of the following signs is considered a positive sign, diagnostic of pregnancy?
So is it A, nausea and vomiting, B, Braxton Hicks contractions, C, active fetal movements palpable by examiner, or D, quickening? Which one?
C.
Which one? A, B, or C, or D? Okay, let me see what the guys are writing. C. Yes. Because which are positive signs? We learned that there are 3 positive signs. Active fetal movement, baby being palpated by the examiner, and then what else? Active fetal movement, palpable by the examiner, positive signs of pregnancy are those that are conclusively confirmed. And then if you also do an ultrasound and find a fetus in there, that's also, positive, right?